Habang naghihintay tayo ng herd immunity, people are now interested in getting booster shots. In fact, si Congressman Zamora nangunguna na. He got 2 new shots. Ano po, a completely different vaccine, 2 complete doses. Ano po yung masasabi niyo? Anong advice niyo to people?
Well, no, in fact, sa pag-uusap namin sa VEP, no, we're looking at that on how we can make a statement on booster doses of COVID-19 vaccine, no? But for now, we don't recommend booster doses. One is that we don't know yet, no? We don't know how long is the protection of these current vaccines. Like for example, Hami, if you have received the 2 dose of the vaccine, kung magpabakuna ka uli ng 3rd dose, kailan ka magpabakuna? Is it on the 3rd month after the 2nd dose? Is it on the 6th month or the 9th month? We need the data coming from the real world evidence from countries who have already rolled out na advance sa atin, at saka yung result ng mga clinical trial, because this clinical trial phase 3 are already in 7th to 8th or 9th month, no? So kung sasabihin nila na we have sustained the efficacy based on our study, 9 months is still okay, 99, 95, 96, then we don't need the vaccine after 9 months, no? And I would just like to relate, no? Pfizer applied for a 3rd dose booster in the US. Okay, I think you've heard of that. But what did FDA in the US and CDC told them? Please wait, because at this moment our breakthrough infection is still manageable, and the vaccines are still effective against the variant. No? So doon natin makikita the importance of having data and evidence.
Mm-hmm. Doc, how do you view the moves of Turkey and the UAE to already start giving booster shots? Tapos Thailand and Indonesia are supposedly considering going in that direction as well. How should you view it?
That's a very good question, Ed. No? And in fact, isa yan sa tatalakayin namin sa VEP. Unang-una, titingnan namin kung ilan ang total na vaccinated, and among those total vaccinated, ilan ang breakthrough infection. No? Sometimes we react because of the news na maraming namatay, but if you compute the vaccination efficacy or effectiveness, pumalo naman pala ng 90%, and we don't need to give a booster on that. No? So titingnan muna natin yung data ng ibang bansa na nagsasabi na they're going to give the 3rd dose based on this rationale, because they have data to support that, no? And dito sa atin, that's why kailangan din natin yung mga clinical data. Doon sa mga bakunahan ng Sinovac na kompleto ng 2 dose, or sa Astra o sa Pfizer, ilan dito ang nagka-infection, ilan ang breakthrough infection. And then we will look at it kung talaga bang alarming na we need a booster shot. Dahil ang importante dito, we need a booster shot. If you're receiving a Sinovac 2 dose, ano ang ibo-booster mo? Is it a 3rd dose of a Sinovac or another platform like a Pfizer or Astra? We have to be definite with that, no? And it should be backed up by evidence.
Yes. Doc, related to the limited supply, ang iniisip ngayon ng ibang tao, magfa-first dose ng 1 brand, yung mix and match na, no? Yung 2nd brand, kahit ano na lang na available. Well, what do you think of the mix and match? I know the World Health Organization said wag daw. But kung walang mapagpupuntahan, paano yun?
Yun nga, problema, Ami, mag-mix and match ka, kulang nga ang bakuna, ano ba yung mix mo? Ano ba yung match mo?
Hindi, no? Kung ano kasi yung dadating, limited yung dumadating sa LGU eh. So, ano yun?
Hindi, ganito yan. Kung limited yung dumarating, yung imi-mix mo, nakalaan na doon sa 2nd dose ng ibang population, di magka-problema tayo, no? So, I mean, we have to focus on what's the current recommendation by the Department of Health, by the expert panel, na? 2 dose, same platform.
Saka yung iba, kapag ganyang na-delay, halimbawa ngayon, merong 1 to 2 weeks delay sa LGUs eh. Tapos yung kumpanya nila nagkaroon, kumukuha na lang yung ng ibang brand from the company. Anong masasabi nyo naman sa gano'n?
So yung delay, that's an acceptable naman na in vaccines, no? 2 weeks, 4 weeks, or even up to 6 weeks delay, no? Pwede pa yan. As long as the 2nd dose should be given and the same platform of the 2nd dose should be given.